Years earlier on, my colleague Linda Alela spoke to retired Lancet CEO Dr. Ahmed Kalebi. Let's listen to that interview.
Now joined by Dr. Ahmed Kalebi, Lancet Kenya founder and retired CEO. Before we get to everything or to anything else, Dr. First of all, we say congratulations for being ranked amongst the world's top pathologists and laboratory medicine professionals.
Thank you, Linda.
It's an honor to have you this evening.
Pleasure too.
All right, we go straight to it. And you have seen the COVID-19 numbers in the last few days. Are we in the fourth wave, as many would argue, in your own assessment?
Yeah, definitely we are in the fourth wave because if you look at the charts for the new cases, you will see that this year we had the third wave, that was around March. And the numbers went down significantly after the lockdown in the disease-infected zones, Nairobi and the 5 counties. Then after that, it started spiking up again, although it didn't go all the way down as previously with the first and the second wave. But clearly, if you look at the charts, we definitely have a fourth wave. You can actually see the numbers going up. So it is a fourth wave and not a third wave.
And just how bad is the situation in the country? Are we overwhelmed?
Yeah, so two things. One, if you look at the number of tests done, they are not as many as we should have, but nonetheless, even with the tests that are being done, the positivity rate is quite high. You're looking at between 13 to 16%. And on the same note, the actual number of positive cases are actually quite high. I think last week we had the highest number of cases in a day ever recorded. And that goes to show you that there is actually an intensifying community spread and increasing numbers. But on the same note, as the Minister or the Cabinet Secretary for Health has indicated, a lot of the hospitals in Nairobi, in Mombasa, are actually now full. And the ICUs for COVID are full. We have more than 500 patients now on oxygen, more than 150 in ICU, compared to just 3-4 weeks ago, we are talking about less than 100 patients on oxygen. So it is a very worrying situation. And the worst part of it, in my view, is that we are not even at the peak yet. We are still heading towards a peak. And currently, where we are is already higher than the first peak and approaching the second peak. So if it continues like this, we might actually surpass the third wave, the peak of the third wave.
And now that we speak about third wave, fourth wave, in most cases then they are named. We have the Delta variant. Just how different is it with the most recent variants that we've had, or the current Lambda, I hear they call it?
Okay, so as just to give a perspective, the original Wuhan variant, that was the original virus. Then we've had quite a number of different mutations that have been described, but there are those ones which the WHO then labels them as variants of concerns. Okay, so basically what we are looking at is with the first wave, it was the original virus from China, so the so-called Wuhan virus. But then after that, we've had viruses that have mutated, and some of them have caused more infection, more severe disease, what are called variants of concern, including the Alpha from the UK, the Beta from South Africa. And then we have had Gamma and now Lambda, but the most concerning is the Delta variant, which was only described earlier this year and first discovered in India. And you saw the devastation it caused in India. And when it caused the devastation in India, the world was quite concerned, but right now it has spread all over the world in more than 124 countries. And in these countries, it has become the dominant variant. And certainly here in Kenya, although the Ministry of Health has not released the actual data in terms of the percentage, we know that it is also the dominant variant in Kenya. It was first described in Kisumu with some travelers who had just come back from the pilgrimage in India. But subsequently, we now have it spreading all over the country. Now, the problem with the Delta variant, much like the other variants which can escape immunity in vaccinated people, it can cause reinfection. But the biggest problem with it is that it is 2 to 3 times more infectious than all the other variants and the original Wuhan virus. And furthermore, people who actually get it, whether they are vaccinated or not, they end up getting very high viral loads, which makes it even more infectious. And that is a big concern. And you might have seen or heard recently, actually in the last few days, the CDC in America, the Center for Disease Control, has actually now advised a mask mandate. Previously, they had said if you have been vaccinated, you don't need to wear a mask if you are outdoors, if you are indoors. But now it's actually being prescribed and being recommended that everybody must be wearing masks even if you are vaccinated, because of this danger of the high transmission and the so-called breakthrough infection in those people who have been vaccinated.
Speaking of the masks, wearing two is way better?
Certainly, yes. If you have the N95 mask is quite good. It is the best. If you have a good N95 mask and you are able to wear it and it can fit properly around your nose and make sure that whatever air you are breathing is actually going through the mask, that is the best. But other masks, particularly the surgical mask, is equally good. Not exactly the same as the N95, but it's quite good. However, what we've noticed, and you'll see it with most people, when you wear the mask, it does not cover your airways. It doesn't cover the nose and the mouth properly, and there's still some air that can come from the side. And for that matter, it's better to wear a proper fitting surgical mask, the ones which are even sold on the streets. But if you have two, it adds you another layer of protection. For sure, the cloth masks that we see people wearing, including their children in school, that is not very, very good, and certainly not the best under the Delta variant. So if people are able to get the properly tested, manufactured surgical masks, that's better than the cloth mask. If you're going to wear a cloth mask, make sure you wear one which is 3 layers, tri-ply, and also one that is fitting properly as well. But the most important thing in all this is that masks are very, very important, very, very critical, and avoid situations where you are rebreathing the same air circulating in a confined space with other people. So if, let's say, you are in an office environment, you should try and be as few people as possible in a room. And the more people you are, the more you make sure that you are, you have that distancing and there is proper ventilation with natural air from outside, flowing through, not just AC. Yeah.
All right. Well, let's talk about what you had earlier mentioned on the hospitals and the preparedness to handle the situation. Well, many hospitals are said to be out of oxygen in the country, especially at the level of the counties. What does this mean?
So as you know, unfortunately, at the moment, there is no definitive cure for COVID-19, for the SARS-CoV-2 virus, for the infection caused by the SARS-CoV-2 virus. So basically, if you get COVID today, and like if, let's say, you got malaria and there's antimalarial that can actually treat it. If you have HIV, we have antiretrovirals that can actually be used to treat it, not necessarily eradicate it. But at the moment, there is no antiviral drug that can actually treat COVID. Treatment of COVID is mainly supportive and symptomatic. And we know the biggest danger with COVID is the damage it causes to the lungs. So when it causes severe damage to the lungs, you're not able to actually breathe in properly and get enough oxygen. And that's why you need additional oxygen, supplemental oxygen, for those people whose lungs are damaged, because they end up getting what we call hypoxia, low oxygen level. And that in particular means you need a higher concentration of oxygen at more than 95% so that you can be able to breathe it and it can be able to support that person. So oxygen is the most critical element in the treatment of people with COVID who have the lung disease. Now, if you don't have oxygen, it's almost a death sentence for that matter, particularly for people who have severe lung disease. And that's what we are seeing. Most of the patients who get admitted in hospitals, most of the patients who get admitted in ICU, those patients are entirely reliant on artificial oxygen, artificially concentrated oxygen, because we know natural air has about 20% oxygen, but you need about almost 100% pure oxygen for you to be able to actually survive. Now, most counties don't have adequate oxygen manufacturing units, and a lot of the counties are actually running on low. And even for private hospitals, we are seeing a shortage of oxygen, and it's a big problem all over the world. You saw what happened in India, where people end up in hospital, but they cannot even get oxygen, and they're dying literally in the admission area. And I think if we see the same situation going on in Kenya, where hospitals are running out of oxygen, running out of beds, it will be terrible. And that's the biggest fear that faces the public health situation. Yeah.
Lots of lessons need to be picked. And Right Honorable Raila Odinga roots for a compulsory health insurance scheme that is after COVID-19 challenges. Why did he have to wait so long, and what more then needs to be done to make sure that we are prepared for such unprecedented eventualities?
I only want to speak to that because of the political connotations, but the reality is that right now in this country, I think it will take a huge effort and quite a lot of investment to actually address the lack of capacity, the lack of personnel, lack of infrastructure, lack of consumables and medication. Because even if you got health insurance now, and you even said, let's say treatment will be free, but we just don't have enough facilities. We don't have adequate capacity. And I think that's the biggest concern. Probably what the government needs to do, if I put it like a chicken and egg situation, the first and foremost thing is to invest in healthcare, invest in personnel, invest in infrastructure. Then you can discuss how you're going to cover for the costs, whether it is through a national health social insurance scheme or out of pocket. But right now, if Linda, God forbid, but if you got sick and you have all the money, you might not be able to get the care you require. That is the danger and the situation we have in this country at the moment.
Oops. God forbid indeed. Now, we got a major boost over the weekend where we received about 410,000 AstraZeneca doses from the United Kingdom. How handy does this come in, noting that by now we have vaccinated less than about 1.5% of our population in comparison to most of the other African countries?
If you ask me, I think what we just got this week is a drop in the ocean. It is probably just enough to vaccinate the people who needed their second doses and some people who are critically in need of the vaccination, particularly the most vulnerable, those are the people with comorbidities. I don't think what we got over the weekend and even what we are expecting from Pfizer is adequate. I think what will make the difference is the 10 million doses from Johnson & Johnson. Certainly, whatever we have received is going a long way, but it's very little. I mean, if you hear from the national government and the Ministry of Health, it has been talking about capacity to vaccinate about 150,000 people a day. So we really need to get the millions of vaccine doses to come so that this can be underway. Right now, where we are not even anywhere close. I will not celebrate whatever we got. No.
I don't know how much of confusion then this would mean. I don't know what you make of the fact that this morning we wake up and we're told, well, AstraZeneca to AstraZeneca dose is the best. The next minute you're told AstraZeneca to Pfizer dose is the best. The next minute you're told, you can even wait longer after getting the first jab. It's more effective that way. A lot of confusion.
As you know, COVID-19, this virus is quite a new virus, even to the whole medical community. And it's less than basically 2 years since we heard about it. Actually, it's 1.5 years. So a lot of things are being discovered as we go along. Studies are being done. Lessons are being learned from experiences. And certainly what you saw with the three major vaccines, that is the Pfizer and Moderna, then the AstraZeneca, and now Johnson & Johnson, there were clinical trials that were done last year, which informed how they're being used. But as time goes by, because of various challenges and also because of experimentation, it has actually been confirmed that the AstraZeneca, which is a viral vector vaccine, although it has less efficacy than the mRNA vaccine like the Pfizer, if used together, it actually has a better effect than using AstraZeneca alone. Certainly, the mRNA vaccines on their own are the best because they have the highest efficacy of more than 94-95%. The AstraZeneca vaccine has around mid-80s in terms of percentage of efficacy. But when you combine the two, it actually boosts the efficacy for the AstraZeneca vaccine. And that is why it is being recommended that where possible, if you're able to get the AstraZeneca followed by a Pfizer vaccine, that is better. But of course, the challenge then becomes, number one, we just don't have these vaccines, whether it's AstraZeneca or Pfizer. Right. Number two, the Pfizer vaccine is a challenge to in terms of logistics and in terms of administration, because you require very, very cold temperatures, which might not be feasible in our situation. So for now, I think the Johnson & Johnson vaccine is our best shot because it's a single dose. It has a fairly good efficacy, and it is easy to administer. But for those who have had the AstraZeneca vaccine, when the Pfizer vaccine comes, if they're able to get a second dose of the Pfizer, then that is better than getting Astra. Yeah.
All right, briefly as we close, the latest global reports indicate that the world risks losing COVID-19 gains that we've made so far owing to the latest variant. One, what does this speak to the situation in the country, and just how soon then do you see us getting out of this?
So, I mean, this is just one variant. That is the Delta variant, and it has spread across the world because of the huge population in India and the connectivity between India and the rest of the world. But we know also that in the Gamma variant in South America is also a huge variant of concern in terms of infecting people who have been vaccinated, causing reinfection. So we have two major variants of concern, the Delta and the Gamma variant. And if with the current situation, what we are literally looking at is, even for those countries which have already had their outbreak, even if they had more than 70% of the population infected and had immunity because of past infection, these variants are just destroying everything now. They're changing the landscape completely. Even countries that have already had vaccination of their population more than 60%, we are seeing this Delta variant actually causing breakthrough infections. So it has completely changed the game. It means it's almost as if we are starting afresh. It's almost as if we are having a new outbreak, a new pandemic altogether. And of course, the biggest concern then becomes that if it continues like this, and then we don't know, will we get another variant which can also end up spreading so rapidly? That is why it is so critical to have as many people as possible vaccinated, because vaccination reduces infection risk, and also it reduces the transmission of the infection, which means less pressure in terms of mutation. And also, definitely, one of the most important things about the vaccination, it reduces morbidity and mortality in terms of the number of people get very sick and in terms of the people who die. So what we have seen, for example, in America, and this is real world situation, and also in Israel, is that more than 99% of the deaths are happening from people who are not vaccinated. So in other words, the people who are vaccinated versus the people who have not been vaccinated, the unvaccinated are having a higher mortality, almost 3 times more. And I think that is the key message, that if we can get the vaccine as soon as possible, and I like what Dr. Githinji, the CEO of AMREF, has said, vaccine delayed is vaccine denied. What we are actually seeing right now is denial of the vaccine to populations that need it the most. So the key thing is getting the vaccines. Hopefully, we can have a sufficient number of people vaccinated and reduce this spread. On the other hand, most of the pharmaceutical companies, that the vaccine manufacturers, are looking at preparing new vaccine that will be able to combat the current variants and even new variants. Now, where do I see us going in terms of this pandemic, how it will evolve? I think it will end up being almost like the previous pandemic, or the so-called Spanish flu of the last century. And what we saw with that, it lasted about 2 years. And I think for now, we should expect this to last 2 to 3 years because of the global connectivity, unlike in the past. So I don't see this completely going away, certainly not with the new variant, certainly not with the lack of vaccination. This, we should all be prepared for the long haul until sometimes in 2022, 2023, before we can actually get to some form of normalcy.
All right, Lancet Kenya founder, Dr. Ahmed Kalebi, thank you so much for speaking to us this evening.